Okay, let's start about muscles of hand. In the hand, we all total have 20 muscles. Okay, 20 muscles. We are categorizing it in the 5 groups. First, it will be thenar muscles. Second, hypothenar muscles. Third, lumbricals. Fourth, palmar interosseous muscles. And fifth, dorsal interosseous muscles. Okay, what is thenar muscles? Thenar muscles are the muscles which are located in the, like this is the thumb and they are here. These muscles are thenar muscles. Okay, and the hypothenar which are below the little finger. The muscles which are below the thumb area, they are the thenar muscles. Okay, and these are hypothenar muscles. And then lumbricals, and then interossei, palmar side. Palmar interossei is that inter means between the bones. They are the palmar interosseous. And then dorsal, they will be in the dorsal side of the. So 4 muscles from here, 4, 4, and 4. They all become 20 muscles. Okay, let's do first thenar muscles. Okay, I will show you one video. What is the functions of the hands? Okay, what is the functions can be performed by thumb? Okay, for the functions of the muscles of the hand, flexion, extension, change the plane, this is abduction, adduction, opposition. In thenar, hypothenar, first is, the first idea is that they are doing flexion, they are doing extension, but extension will be at the dorsum, at the posterior compartment. Okay, flexor, abductor, then opponents, and adductor. Okay, same here, flexor, abductor, opponents, but not adductor over here, it's palmaris. Okay, and the one more idea that they are the muscles of hand. They can't be the long muscles, they are the short muscles. And for we are using for the our thumb, that is pollicis. And for our thumb we are using digiti minimi. And the all muscles in the hand will be short, so they are brevis, small muscle. So pollicis brevis. So we will add here flexor, pollicis brevis, abductor, pollicis brevis. Opponents, no, there is no long muscle of this, so this is only single muscle. So opponents pollicis and adductor pollicis. Okay, adductor pollicis. And over here, flexor, yes, digiti minimi, abductor digiti minimi, opponents digiti minimi, and palmaris brevis. Remember, we have done longus muscle in the forearm anterior compartment. Yes, palmaris longus, but over here palmaris brevis. Now, let's go to the, again we will make how they are originating and what is their innervation. The originating, for example, the our thumb is, all the thumb and muscles of the thumb is innervated by median nerve. Okay, these all 3 muscles are innervated by median nerve, but the except this muscle and the all ulnar side are innervated by ulnar nerve. Okay, and this is also so the thenar muscles, the which are located below the thumb, flexor pollicis brevis, abductor pollicis brevis, and opponens pollicis, they are innervated by the median nerve, but the adductor pollicis, which is supplied by ulnar. Okay, so this is our hand. Okay, so here is the our thenar muscles. Here will be hypothenar muscles, and the median nerve will go all through the way like here, and here is the adductor pollicis. So mid ulnar nerve go, and it will also give to the adductor pollicis. So let's do the innervation of it, how they are origin. So this is, we have the carpal bones. Of course they are originating from there. We have 4 distal and 4 proximal carpal bones. The most common mnemonic, she looks too pretty, try to catch her. Try to catch her. S scaphoid, L lunate, T triquetrum, P pisiform, trapezium. Okay, then trapezoid, C capitate, and H hamate. Okay, and we will have the following. First metacarpal. We always know that our first metacarpal start from the lateral side, that is the thumb. Our second metacarpal, third, fourth, and fifth. We have 2 phalanges in the thumb, and all other have 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay, so how our muscles are originating? So here will be thenar group, here hypothenar group. So in first of all, we will learn that the most lateral muscle will be our abductor, because they are this is performing the abduction, so it should be the lateral, and they are the short muscle. So of course they will originate from here, from the scaphoid and triquetrum, and the muscle will be starting from hypothenar, will be from pisiform and hamate. So in the first of all, it can be maximum how long? Till the first phalanges. Okay, so the abductor will start and more than more till the first phalange. Abductor pollicis brevis. Okay, then the second muscle will be flexor pollicis brevis. Flexor pollicis brevis. This is first one, this is the second one. Okay, and then we have the third muscle. Which muscle is left now? That is opponens. So it will start and just end there until our first phalange, first metacarpal mid shaft. This is the short muscle. This is opponens pollicis. Okay, and then let's come to hypothenar group. In hypothenar, same, we have the first muscle, the most middle muscle will be abductor. Okay, abductor digiti minimi. Second will be flexor digiti minimi, and then we don't have over here the from the mid shaft. This will be opponens digiti minimi. And then palmaris brevis. Palmaris brevis is the subcutaneous muscle. In the dissection, if we will cut the area of the hypothenar after the skin, we will find the palmaris brevis. So it is very subcutaneous over here. Palmaris brevis, subcutaneously present. Okay. And then now we have left for the one muscle over here, that is adduction. Okay, adduction muscle. In adduction muscle, it's about there is two head in the adduction. In the adduction pollicis, first head will be from the third phalange. Okay, they arise from this is the first metacarpal, second metacarpal, and this is the third metacarpal. So it arises from the third metacarpal, and the second second head is the transverse head. Now we have one muscle left in thenar group, is that adductor pollicis. Adductor pollicis, it will help to adduction, so it should be the medial side. So how it have two head? Okay, two head muscle, that is transverse muscle and oblique muscle. The transverse muscle will be originating from the first phalanges, and it will come to the mid shaft of the third metacarpal, like this. And the transverse will come from the first metacarpal base, second metacarpal base, and the capitate bone of carpal, like this. So one muscle is transverse muscles of adductor pollicis, and this is the oblique muscle of adductor pollicis. Okay, so the hypothenar group is getting supply from the ulnar nerve along with the adductor muscle, whereas the hypothenar group is getting supply from median nerve. Okay, one more thing to add over here is that if a patient comes to you with the ulnar deformity, ulnar nerve injury, and so in these, what can be seen in the thumb, what will be the dysfunction associated with that patient? So ulnar is getting to hypothenar and the adduction muscle of the thenar group. Okay, so patient can't adduct in the ulnar nerve deformity. Okay, adduction cannot be performed in the ulnar nerve. Okay, if I will ask what will be happen if the median nerve is affected, okay, in the thumb. So what he can't do? He can't do opposition. See, flexor pollicis brevis flexion can also be done with the flexor pollicis longus, and abduction can also be performed by abduction pollicis longus, but there is only one muscle's opponent's pollicis. So opposition can be reduced, or we can say can't be seen in that patient with the median nerve injury. Now, if there is also a patient with the injury of radial nerve, okay, yes, of course, the extensor muscle will be affected. That will be the muscles of the thumb. So, in the radial nerve injury, yes, we can see the extension that is applied the backside of the thumb. Extension is reduced. So, among all these fingers, in which finger we can see all three injury? That is thumb. In thumb, we can see opposition is reduced. With that, the median nerve injury. We can see ulnar nerve injury in the adduction, and we can see the radial nerve injury in extension. Okay, so I guess this was asked in the exam. So until now we have done the thenar group and hypothenar group. Now we have other three muscles: interosseous muscles, lumbricals, and dorsal interosseous muscles. After thenar and hypothenar muscles, let's do lumbricals. Lumbricals we are having 4 in number and they are given in the green color. These are having the characteristic feature. These are originating from the tendons and they are inserting to the tendons, not like other muscles. Other muscles are originating from bone and inserting to the bone. But over here you can see these are the flexor digitorum profundus. Okay, and they are coming from they are originating from these profundus tendons. Okay, and they're going back and attaching to the extensor hood, common extensor hood. Okay, so the first and the second, this is the first and this is second lumbricals, they are unipinnate, whereas third and fourth they are bipinnate. Okay, so let's draw a picture over here. So we are having flexor digitorum profundus. This is FTP. And they are originating from here. The first will be the lateral, like this, and they are turning over here. In the second, from the second tendon, they're coming and going back. And the third, they are bipinnate. Okay, these are also going to the back side of the tendon, and then again fourth. So this is the first, second, third and fourth. Let's write their origin and their insertion. Their origin are flexor digitorum profundus. Insertion, their insertion is extensor hood at the back side or dorsal digital expansion. Okay, their nerve supply. So they are the lateral side. These are the lateral side. So the lateral side are supplied by, yes, they are supplied by median nerve, and over here they are supplied by ulnar nerve. So first and second lumbricals to the medial and third and fourth to the ulnar. So nerve supply of the first and second, they are unipinnate by median nerve. Third and fourth, they are bipinnate. They are supplied by ulnar nerve. What are their action? Their action is, for example, this is our fingers and this is our wrist. Okay, this is the metacarpal joint. Okay, so what they are doing? They are doing the flexion at metacarpal joint. See, they are doing flexion at the metacarpal joint, but at the same time they are doing extension at interphalangeal joint. Okay, so their origin from tendon, inserting at the tendon to the dorsal digital expansion. Nerve supply to the radial side will be median nerve, to the thumb side is the median nerve, and to the ulnar side will be ulnar nerve. Action, metacarpal joint will be having flexion and interphalangeal joint extension. After lumbricals, we have palmar and dorsal interossei. With the name, they are get to know that they are the interossei between the bones. Okay, so they are between the metacarpals, and the palmar side will be palmar and the dorsal side will be the dorsal. How to know that this is whether palmar side or this is dorsal side? In the palmar side, this is the unipinnate bones. Okay, so they are unipinnate. See, they are unipinnate, and whereas the dorsal are the bipinnate muscles. see bipinnate. Okay, so let's write the difference between them. In the palmar side, palmar, and here dorsal. Palmar is unipinnate. This is bipinnate. And there is a golden rule for the dorsal and palmar bipinnate is that the all interosseous muscles of the hand are supplied by dorsal and palmar are supplied by ulnar nerve, whether it is palmar or dorsal. Okay, what is the actions? Let's see the actions. See over here. They are attached to the medial side. Okay, see this side. So their action should be what? Their action should be like this. Okay, so it should be like this. There should be contact. If it's contracting, what will happen? It will pull the thumb to the central of axis. What is the central of axis? The middle finger. Okay, so action is, that is a mnemonic. PAD means palmar adduction. And here what they are doing, this muscle they will take away the finger from the central axis. So this is dorsal, that is abduction. Okay, dorsal abduction. So adduction will be here, and in here there will be abduction, taking away from the central axis. And there is another thing to notice here, that in the middle finger there is no attachment of the muscle. Okay, and in the dorsal side there is no attachment to the little finger and to the little finger and to the thumb, and over here to the middle finger. So let's write that also. Here there is no attachment, no dorsal interosseous bear at middle finger, no. No dorsal interosseous at thumb and little finger. Whereas here no palmar interosseous at middle finger. Okay, so there is no muscle in the palmar side of the middle finger, and there is no muscle in the thumb and the little finger. Okay, and here, whereas we will see in the middle finger it is having bipinnate, here no. So we will also add this in the dorsal side. There is two dorsal interosseous at mid finger. Okay, there is also a card test over here. What is a card test? That it is showing the adduction, right? It is showing adduction. So we will ask a patient who is having the ulnar nerve injury, we'll ask the patient to hold the card between the fingers. Card test. So if he is unable to hold the cards between the fingers, it means there is ulnar nerve damage. And for the abduction, we will ask the patient to put their hand on the flat surface, and we'll ask the patient to move the middle finger. That is a GAVA test.